I'm finding acute medicine a big step up from medical school because you have a lot more responsibility. You're managing a whole ward of patients who are quite acutely unwell. My name's Alicia Gupta and I'm a foundation year 1 doctor working at EAU at North Seas Hospital. So I felt quite supported in this role because in the morning you have a handover and any very sick patients get discussed in the morning, so everyone's aware about them. So if something were to happen, people have a bit of background context and can go and manage them, so it's not all on you. And then in the mornings we do a ward round with the consultant, and on this you go through each patient and you're able to ask them questions about managing the patient, and it's a good learning opportunity to find out what you need to do and why you have to do it, so you're not just following the jobs list. And then in the afternoon you go through all the jobs. If you've got questions, there's always people in the doctor's office that you can ask for help, and you can always ask the nurses and healthcare assistants to help you with other tasks as well. Like, it's a whole team managing a patient, it's not just you, and there's always people you can go and ask questions or escalate things to if you're worried about someone or something. So my first night shift was on Christmas Day, and initially I was quite scared because I thought it was going to be very busy and this was my first ever night shift, but actually the whole team came together and it was a very supportive environment. Everyone was helping each other with different tasks and we managed to make sure everyone was okay. No one had any fatal injuries or accidents. So I really enjoyed working Christmas Day, surprisingly. So what I'd tell someone who's about to start a placement on acute medicine is to be kind to yourself, because each day you're going to have a lot of sick and unwell patients and it is very overwhelming, particularly at the start. But I think it's important to remember that you are new, you've just started this, and there's a lot to learn and it's quite a big step. So by being kind to yourself and acknowledging that and just trying to do the best that you can, and also being able to know who to ask for help and when to ask for help. I chose the North East and North Cumbria region for my training, primarily because I do the academic foundation programme, and in the North East you get to do 2 research blocks, one in F1, one in F2, whereas everywhere else in the country you just get to do it in F2. So I like the idea of being able to start a project in F1 and being able to follow that through to F2. And also I'd spoken to a lot of trainees who were already training in the North East, and they all said really positive things about it, that it's a really nice area to work in, the people are friendly, the cost of living is cheaper than in the south and in London, and there's a lot of stuff to do outdoors, and I'm quite outdoorsy myself, so there's a lot of beaches, national parks. So if you're coming up to the North East and North Cumbria region for your training, I promise that you will find your place here.